National Healthcare Providers Association are marching to the offices of medical aid giant Discovery in Sandton today. The group of doctors will hand over a memorandum asking the company to stop forcing patients to change doctors. ENCA's Yanke Tome joins us live from Sandton. Yanke, talk to us about what is at the core of the complaint by black doctors.
Well, Molly, it is in fact actually a group of both black and Indian health practitioners who have raised concerns basically of racial discrimination and unfair treatment by medical schemes, including by Discovery. As you can see behind me, there's already a couple of health practitioners who have gathered here, and we will be marching to Discovery soon. But before that, I do have Dr. Prudence Buthelezi here with me from the NHPA. Doctor, to just give us some more information, let's start with what is at the core of your grievances that inspired the march today.
What inspired our march today is firstly the unit of the healthcare practitioners with the patient, because today we are fighting for the right of the patient. The patient has a right to choose their doctor. The patient has a right to choose any pharmacy that they want. The patient has a right to be treated the way they wanted, to any hospital, not medical aid to choose the hospital. Number two, we're saying to the medical aid, stop auditing the doctors illegally, so coming with the cameras in our offices. Number two, we're saying stop this auditing when we have done, and stopping the payment from the healthcare practitioners. We say release those monies that you have stopped, we have collected from the doctors, that they should go back to the patient. We also saying to the medical aid, enough is enough today, because what you have done, it has killed many doctors, it has led many healthcare practitioners to commit suicide.
According to you, what is behind these actions by the medical schemes?
It's all about money and saving costs. Medical aids, they don't want to pay. When the patient, they say they will offer 100% coverage. But when the patient is admitted, when she leaves the hospital, she will be living in depression, in distress, because they don't want to pay Sandton services. They don't want to pay the doctors in full. So all they're doing is to save the cost for themselves and not caring about the patient. And remember that as doctors, we have the ethics that we took, that we must do what is best for the patient and not what is best for the medical aid. What I'm talking about is this DSP, designated service providers. Those are the doctors that have chosen to be remote control by the medical aid. And we say that is wrong. As a healthcare practitioner, I have the duty to treat the patient, not to save money for the medical aid.
Now, there has also been some concerns about racial discrimination. Where does that fit into your grievances?
The what?
Racial discrimination.
This is happening to black. I can start with the black patient. They will call the black patient and ask him, did you really go and see Dr. Buthelezi? What did he give you the medication? To take a photo and show us the medication. They will call and even go to their workplace and see, can I see where did the doctor cut you? That's wrong, and you are violating the privacy of the patient. Number two, what is leading to discrimination? As you can see here, it's only black healthcare practitioners where they stop the payment and they ask AOT acknowledgement of that the black doctors, they must pay back the monies.
Okay, thank you very much, Doctor. Molly, I also have here with me Temba Kumalu from the Mbumba Business Forum. He represents also some of the healthcare practitioners who are marching to Discovery today. Just give us your side of what are some of your members facing? What challenges are they facing?
Okay, currently we are representing different sectors, of which health practitioners, it's our members. And yes, they don't pay them in time at all, and they have to choose their own doctors. Especially, they want to make use of white doctors, which means it's a white monopoly system that they only developed white-owned businesses. And we are saying as Mbumba Business Association, it must fall. We are against white monopoly. We are going to fight, not indirect, direct. If it means that we go down to the consumers and train them and tell them that they are beneficiaries, they've got a right to use their own doctors of their choice. Thank you.
Thank you very much. It seems like we are getting ready to start the march. We're running a bit late. We were supposed to be at Discovery by this time, so I'm sure they do want to get underway so that they can hand over that memorandum of demands as soon as possible.
All right, thank you very much. That's my colleague Yanke Tolme at a march by Black and Indian doctors who are taking their grievances to medical aid giant Discovery. And they're saying that they're unhappy about Discovery, who is or which is allegedly forcing patients to change doctors. And so they're saying that this is a violation not just of their rights, but also the rights of patients. Let's